So, this arthritis pain reliever can help with various types of pain, such as headaches, menstrual periods, toothaches, backaches, osteoarthritis, or cold/flu aches and pains. It can also be used to reduce fever. The daily dosage for adults is 325 to 650 mg every 4 to 6 hours as needed, and the maximum dosage is 3,250 mg per day. It's best to take this medication with a full glass of water and with food to minimize stomach irritation. Remember to follow the instructions on the label and consult with a healthcare professional if you have any concerns. When taking this arthritis pain reliever, it's important to follow the directions on the product package. Be sure to read the dosing instructions carefully for each product, as the amount of acetaminophen may vary between brands. It's crucial not to exceed the recommended dosage to avoid potential side effects. If you're giving this medication to a child, make sure to use a product specifically meant for children and use their weight to determine the correct dose. For liquid medications, shake well before each dose and use the provided dose measuring tool to ensure the right amount is given. For rapidly dissolving or chewable tablets, follow the specific instructions for each type and avoid crushing or chewing extended-release tablets. It's important to take the medication at the first signs of pain for optimal effectiveness. Also, remember not to take this medication for fever for more than 3 days, 10 days for adults, 5 days for children, unless directed by your doctor. If your condition persists, worsens, or if you develop new symptoms, be sure to consult your doctor. And if you suspect a serious medical issue, seek medical help promptly. If you experience any unusual effects, it's important to contact your doctor or pharmacist right away. While this medication usually has no side effects, it's still important to be aware of any potential symptoms. Your doctor has prescribed this medication because they believe the benefits outweigh the risks of side effects. Serious allergic reactions to this medication are rare, but if you notice any symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. In the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. It's important to be cautious when taking acetaminophen, as taking too much can cause serious liver disease. Adults should not take more than 4,000 mg, 4 grams, of acetaminophen a day. If you have liver problems or are giving it to a child, you should take less acetaminophen. Make sure to ask your doctor or pharmacist about the safe amount for you. Do not use any other drugs containing acetaminophen without consulting your doctor or pharmacist first. Acetaminophen can be found in many over-the-counter and prescription medications, so it's important to check the labels of all your medicines and ask your pharmacist if you're unsure. If you take too much acetaminophen, seek medical help immediately, even if you feel fine. Overdose symptoms may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. Daily alcohol use, especially when combined with acetaminophen, may harm your liver, so it's best to avoid alcohol while taking this medication. Before taking acetaminophen, it's important to tell your doctor or pharmacist if you're allergic to it or if you have any other allergies. This medication may also contain inactive ingredients that could cause allergic reactions or other problems, so it's best to talk to your pharmacist for more details. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have liver disease or if you regularly use or abuse alcohol. If you're considering using liquid products, chewable tablets, dissolving/effervescent tablets, or powders, it's important to note that they may contain sugar or aspartame. If you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet, it's best to exercise caution. You should ask your doctor or pharmacist about using these products safely if you have any of these conditions. If you're pregnant, it's important to inform your doctor before using this medication, as well as if you're breastfeeding, as acetaminophen does pass into breast milk. Consulting your doctor before breastfeeding is essential. Drug interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include ketoconazole and levoketoconazole. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you are using this drug. If you suspect an overdose and the person is experiencing serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. It's important to seek medical help if you or someone you know is experiencing these symptoms. Unlike NSAIDs, such as aspirin and ibuprofen, acetaminophen does not cause stomach and intestinal ulcers. However, it also does not reduce inflammation like NSAIDs do. It's important to consult with your doctor to determine which medication is right for you. When taking acetaminophen for arthritis pain, it's important to follow the recommended daily dosage and take it at the optimal timing for the best relief. Always consult with your healthcare provider for personalized advice. If you are taking this medication regularly and happen to miss a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose at the usual time. Do not take a double dose to make up for the missed one. Be sure to store this arthritis pain reliever at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.